A cancer trial's unexpected result, remission in every patient. It was a little primer, just 18 rectal infection patients, every one of whom took a comparative prescription. Be that as it may, the results were surprising. Sickness dissipated in every single patient, impalpable by real tests, endoscopy, positron release, tomography, PET compasses, or MRI checks. Dr. Luis A. Diaz Jr. of Memorial Sloan Kettering Cancer Center, and maker of a paper disseminated Sunday in the New England Journal of Medicine depicting the results, which were upheld by Drug Association GlaxoSmithKline, said he had some awareness of no other pack where a treatment completely squashed illness in each tireless. I acknowledge this is the point at which this initiative has happened all through the whole presence of the sickness, Diaz said. Dr. Alan P. Venuk, a colorectal dangerous development master at the University of California, San Francisco, who was not locked in with the survey, said he similarly thought this was a first. A complete decrease in every single patient is amazing, he said. These rectal sickness patients had defied overpowering treatments, chemotherapy, radiation, and, without a doubt, groundbreaking operations that could achieve entrail, urinary and sexual brokenness. Some would require colostomy packs. They entered the audit trusting that, when it was done, they would have to go through those techniques considering the way that no one really guessed that their malignant growths ought to disappear. Regardless, they got a shock. No further treatment was key. There were a lot of merry tears, said Dr. Andrea Sursek, an oncologist at Memorial Sloan Kettering Cancer Center and a co-maker of the paper, which was presented Sunday at the yearly assembling of the American Society of Clinical Oncology. Another bewilderment, Venuk added, was that none of the patients had clinically basic complexities. All around, 1 out of 5 patients has some sort of ominous reaction to drugs like the one the patients took, dostarlimab, known as assigned spot inhibitors. The medication was permitted at normal spans for quite a while and cost about $11,000 per segment. It uncovered sickness cells, allowing the insusceptible structure to perceive inhibitory and obit.